Good afternoon, everyone. Today, there are 12 new cases of COVID-19 confirmed cases in New Brunswick. Of the 12 new cases, 11 are related to travel, and I will elaborate on the other one shortly. This brings the total number of cases in the province to 45. Aujourd'hui, j'annonce qu'il y a 12 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick, portant le nombre total de cas à 45 dans la province. This is entirely expected. The return of large numbers of travelers to the province who are aware that they are potential carriers of this virus has created the conditions for this increase in cases. It remains vital that those who are in self-isolation continue to isolate themselves for at least 14 days after being directed to do so. And it is vital that we stay home as much as possible, practice proper hygiene, and maintain physical distancing that will slow the further spread of this virus within our province. Among the new cases I am announcing today is one which is being investigated as a possible instance of community transmission, a case that cannot be traced to an infection that occurred outside of our province. And I just want to elaborate that with respect to when we say travel-related. So up until now, when I've spoken about travel-related cases, I didn't necessarily mean that that actual person who was diagnosed with COVID-19 had traveled, but they had a direct link somewhere along the transmission chain that could be traced back to someone who had traveled. So when we're doing our investigations, the type of information that we're looking for will lead us to close contacts who may be close contacts or to cases who may be connected to somebody who had traveled. When we're talking about community transmission, we're not able to find those links and connections to a case that had originally traveled. So this will necessitate proactive changes to our testing protocols, which I will speak to shortly. The new cases being announced today include 4 cases in Zone 1, which is southeastern New Brunswick, and 1 case in Zone 2, 3 cases in Zone 3, and 3 cases in Zone 4, and 1 new case in Zone 5, which is the north-central part of New Brunswick. Les nouveaux cas que nous annonçons aujourd'hui sont répartis comme suit. Il y a 4 nouveaux cas dans la Zone 1, il y a un nouveau cas dans la zone 2, le sud du Nouveau-Brunswick. Il y a 3 nouveaux cas dans la zone 3, les individus. Dans la zone 4, il y a 3 nouveaux cas. Ça, c'est le nord-ouest du Nouveau-Brunswick. Il y a un nouveau cas dans la zone 5, c'est le centre-nord du Nouveau-Brunswick. I am also bringing to the public's attention 2 confirmed cases that are related to flights that arrived at New Brunswick airports. The first is Air Canada Flight 8900 from Montreal to Moncton that arrived March 16th. All passengers on that flight should already be self-isolating. The second case involves Sunwing Flight 169 that arrived from Punta Cana to Fredericton on March 18th. All passengers on that flight should already be self-isolating. In addition, one of the previously confirmed cases has now recovered. So that is a good news story. As I stated yesterday, our approach to this disease will evolve as the pandemic evolves. With the potential for community transmission within New Brunswick, we will focus on protecting those who are working hard to protect us. We will continue to test cases related to travel, those with COVID-19 symptoms that have traveled outside of New Brunswick, and those with symptoms who have had contact with suspected or confirmed cases of COVID-19. We are now moving to expand this testing protocol to cover our healthcare workers, those who have not traveled but have developed a new cough, fever, or shortness of breath. Identifying symptomatic healthcare workers will help to slow the transmission to other workers and protect the most vulnerable. As of today, all workers in our healthcare sector, employees of regional health authorities, long-term care facilities, extramural hospital, Ambulance New Brunswick, community physicians and pharmacists that have developed COVID-19 symptoms since March 20th, 2020, are directed to immediately self-isolate. Information on a toll-free number to seek assistance will be available tomorrow. À compter d'aujourd'hui, tous les travailleurs du secteur des soins de santé, soit les employés des régies régionales de la santé, des établissements de soins de longue durée, du programme extramural et d'Ambulance Nouveau-Brunswick, ainsi que les médecins et les pharmaciens en milieu communautaire qui présentent des symptômes de la COVID-19 depuis le 20 mars sont appelés à s'auto-isoler immédiatement. Les détails au sujet d'un numéro de téléphone sans frais pour informer supplémentaire sera disponible demain. It remains vitally important that every New Brunswicker be on alert for the symptoms of COVID-19 for themselves and their families. Use the self-assessment tool on the GNB website for guidance and contact 811 if you have symptoms. And as I have said before, and I will repeat again today, everyone should act as if they already have COVID-19. That means remaining isolated. If you have no symptoms, I encourage you to get fresh air once in a while by practice physical distancing. It's okay to go get groceries once a week, but we also really want people to act as if they already have COVID-19 and could potentially transmit it to family members, loved ones, and members of the community, or healthcare workers or other essential workers. Je dois répéter, si vous avez des symptômes de la COVID-19, vous devez vous comporter comme si vous aviez la COVID-19. Vous devez ainsi vous isoler sur le champ. Do not put others at risk by acting as if you do not have the disease. We all have a responsibility to honestly assess our personal health and to protect those around us. This is of particular concern for our healthcare workers, doctors, nurses, paramedics, and others who, in the course of their duties, must come into direct contact with those who may be infected with COVID-19. We cannot risk anyone becoming seriously ill. If you or a loved one are experiencing symptoms that require immediate medical attention, it is vital that you inform the 911 operator that COVID-19 may be present in your home. This will allow first responders to be fully prepared to care for you. You will not be refused care because of the virus. Our first responders will respond, but we need you to give them the opportunity to be fully prepared to provide appropriate care without risking their own health. Self-isolation is difficult, but it is absolutely necessary to slow the spread of this virus. For some of you who returned to the province in the first stage of the pandemic, your 14 days of self-isolation is now coming to an end, and you may be wondering what to do next. I suggest you do what your neighbors are already doing. Stay at home as much as possible. Practice proper hygiene and maintain appropriate physical distancing. That means keeping a distance of 2 meters or 6 feet between yourself and others at all times. Hand washing is very important. Washing your hands in hot soapy water for 20 to 30 seconds. Coughing into your elbow and disposing of your tissues when you blow your nose. You must continue to monitor your own health. Isolation does not mean immunity to COVID-19. Maintain your vigilance for symptoms. And please look after yourselves. All of us are under unprecedented stress and anxiety. No one is alone in this, so eat well, exercise regularly, and get plenty of sleep, and avoid information overload. This will not be over anytime soon, and we all know the road ahead will be difficult, but I urge you to not give up. Nous savons tous que le chemin qui nous reste à parcourir sera difficile, mais je vous supplie de ne pas abandonner. Thank you very much.
Good afternoon. Bonjour. We know we have not yet reached the peak of COVID-19, and we know there are many days ahead that we'll be counting additional numbers and be dealing with it appropriately. Now more than ever, I want to remind New Brunswick of the importance of physically distancing themselves and from all of the other recommendations and requirements that have been put in place by our Public Health Officer, Dr. Russell. Within the province, I'm very proud of how well all of our all-party cabinet committee on COVID-19 has been working together since it was formed just 3 weeks ago. The situation is continuing to evolve rapidly in a short period of time, and this committee has played a crucial role by taking a nonpartisan approach to leading the province forward. Our province has also been working very closely with the federal government and with other Canadian provinces and territories. I have participated in 2 First Minister's calls organized by the Prime Minister, and I've been part of regular weekly meetings with all Canadian premiers over the past few weeks through the Council of Federation. This has helped open up direct lines of communication between provincial and federal departments and has allowed us to address problems in real time as they arise. J'ai participé à 2 conférences téléphoniques avec les autres premiers ministres des provinces et des territoires qui avaient été organisées par le Premier ministre du Canada. Dans les dernières semaines, j'ai aussi participé à des réunions régulières, chaque semaine, avec les autres premiers ministres des provinces et des territoires dans le cadre du Conseil de la Fédération. Cela nous aide à avoir des lignes de communication directes entre les ministères provinciaux et les ministères fédéraux. Cela nous permet aussi de régler les problèmes en temps réel quand ils persistent. We have quick access to the Prime Minister and the Deputy Prime Minister to bring resolutions to any issues we may encounter. We will ensure that we have enough medical equipment, and that includes face masks, gloves, respirators, and ventilators. We now have centralized the approach in place that will attain necessary health items that we may require in this pandemic continues. This approach will reduce internal competition and expedite the delivery of the items our province needs. Work is underway to retool certain plants to produce ventilators. Premier Ford in Ontario has led this effort, and he deserves a lot of credit for his work with the automotive industry and the manufacturing sector of Canada. Hand sanitizer plays an important role in protecting frontline essential workers and all residents from illness, and it was one of the first things to disappear from store shelves when this pandemic began. There are many facilities now that are changing their normal operations to start producing hand sanitizer. Les disinfectants pour les mains jouent un rôle important afin de protéger les travailleurs essentiels de première ligne et tous les résidents. Et c'est un précédent produit, c'est disparu des magasins quand la pandémie a débuté. On a rapporté que plusieurs entreprises ont changé leur opération normale pour commencer à produire des désinfectants pour les mains. The cooperation amongst the federal government, provinces, and territories has never been greater. During my most recent Council Federation called, I joined my fellow premiers in supporting the ongoing efforts announced by the federal government. New Brunswick will continue to rally to support the other Canadian provinces and territories as much as we can, and I know they will do the very same for us. Through these channels, we are already starting to discuss our country's eventual recovery from this pandemic. Eventually, this situation will end. And as a nation, we will need to make the right decisions to restart our economy, repair the damage that has been done, and put us on a trajectory that will bring prosperity to Canada and the resilient residents of New Brunswick. Under these difficult circumstances, we are seeing just how strong our country and our province truly can be. Here in New Brunswick, we will continue to take measures to keep residents safe. We are repositioning schools to take care of the homeless. We are protecting our seniors by moving those who are in hospitals, receiving alternate levels of care, into nursing homes wherever possible. We are continuing to work with the Red Cross to provide a one-time income benefit of $900 for workers or self-employed people in New Brunswick who have lost their job due to the state of emergency. I'm very pleased that the Red Cross has confirmed a website will be up by Monday at noon that will provide information and will allow people to apply for the benefit. Payments will begin on Thursday of next week. I want to personally thank the Red Cross for the response and support. This is exactly the type of partnership we need during difficult times. It was recently brought to my attention that people trying to call for information were not able to leave a message when calling after hours. I have looked into this, and from now on, callers will have the option to leave a message, and someone will respond during regular hours. I know New Brunswickers are anxious about the current situation. We are all adapting to a very different way of life than we have been used to. I encourage residents to visit the Government of New Brunswick's coronavirus website for resources, including tips for dealing with stress during this emergency situation. Je sais que les gens de Nouveau-Brunswick vivent de l'anxiété en raison de la situation actuelle. Tout le monde doit s'adapter à ce mode de vie très différent de tout ce que nous avons connu avant. J'encourage la population à consulter le site web du gouvernement de Nouveau-Brunswick sur le coronavirus pour avoir accès à des ressources, comme des conseils sur la manière de gérer le stress lors d'une situation d'urgence. This continues to be a difficult time for all of us, but we will get through it, and we will persevere as long as we continue to be patient, listen to the advice of public health, and take care of each other. Thank you. Merci.
Thank you, Premier. We will now proceed
to questions from the media. Nous allons maintenant procéder aux questions des journalistes. Each reporter will have one question, and you are invited to ask the question in English or in French. Chaque journaliste aura droit à une question et vous êtes invité à demander vos questions en anglais ou en français. Alors, nous allons débuter aujourd'hui avec Michel Corriveau, Radio-Canada.
Bonjour, j'ai une question pour le Premier ministre, M. Higgs. Il y a des professionnels de la santé et des citoyens qui s'inquiètent et qui aimeraient avoir accès à des tests. Qu'est-ce que la province peut faire pour augmenter les capacités de faire des tests?
Bonjour Michel, c'est Dr. Russell ici. C'est moi qui vais répondre à la question. Alors, notre capacité de faire des tests, c'est quelque chose qu'on a déjà. C'est pas la question de combien de tests qu'on va faire, c'est le test de qui qu'on va tester. Qui est les gens qu'on devrait tester, à quel temps, pour telle raison. Alors, avant qu'on avait eu la transmission seulement liée au voyage, on testait les gens qui avaient une histoire de voyage avec les symptômes. Maintenant qu'on croit qu'on est vraiment proche à dire qu'il y a de la transmission dans la communauté, ça veut dire que les gens qu'on va tester, ça va changer. Et même avant qu'on a eu cette information, on a commencé à faire ce qui en anglais, ça s'appelle sentinel testing. Alors, ça veut dire qu'au commencement de la semaine, on a commencé à tester des gens qui n'ont pas voyagé pour chercher pour les cas de transmission dans la communauté. Et dès que maintenant, tous les tests qu'on avait faits avec les gens qui n'ont pas voyagé ont été négatifs. Alors, on l'a pas trouvé encore dans les endroits qu'on teste maintenant dans les hôpitaux et quoi que ce soit. Mais je crois que, au fur et à mesure qu'on reçoit d'autres résultats de ces cas qui n'ont pas voyagé, on va en trouver d'autres. Et avec ce cas que j'ai annoncé aujourd'hui, qu'on n'est pas certaine encore que c'est un cas de transmission de communauté, on croit que c'est y arrivé et on va changer la manière qu'on teste aujourd'hui. Alors, ça veut dire qu'à partir d'aujourd'hui, on va tester les travailleurs de santé qui ont des symptômes, mais qui n'ont pas voyagé.
Merci. Andrew Waugh, Telegraph Journal.
Yeah, hi. Dr. Russell, can you give us some more specifics about this case that is not, doesn't seem to be linked by travel? Exactly where is it? Has this person been in the public lately?
So throughout this whole pandemic, what we're going to be seeing is different types of transmission. And because of all the measures that are in place right now, we hope that people are staying at home as much as possible. So with respect to most of the travel-related cases who came within the last, when the international borders have closed and when our provincial borders have been limiting people in terms of accountability and staying home for 14 days. We hope that many, many, many numbers of people in this province are self-isolating currently who are supposed to be, and those who are not supposed to be self-isolating are still staying home and only going out to run errands and do groceries, and they're staying 6 feet apart from everyone. So I will speak to the issue around the investigation of each and every case and each and every contact, but the backdrop of all of that has to be understood, that everyone has to act as if they have COVID-19 and they should be staying at home, and especially if they have symptoms, obviously. So, and the other thing I will say about testing is that you have to test at the right time. So this virus, in terms of when people are contagious, it's usually only once they become symptomatic to about 8 to 10 days afterwards. So there's a window of opportunity where if we test outside that window, we know that the test results could be falsely negative, and we wouldn't want to give people the wrong information around that. So when it comes to testing, we have to test the right people at the right time. So with respect to the investigation, I will be more broad and general around the fact that when we do the contact tracing, initially, we knew that all the cases would be travel-related, and so we were really tracing contacts around people who had traveled. And then when those close contacts were self-isolating and they developed symptoms, then we were testing those people and then tracing their contacts. But really, once you've traced a contact and they're staying at home, then there's a narrow population that has been exposed. So in this case, I don't have any other details around their movements or where they have been, other than to say that everyone in the province should be staying home as much as possible. And when you are out, you should be social distancing. You should have 6 feet apart between you and another person.
Thank you. Silas Brown, Global News.
Hi, Dr. Russell. I'm curious if you could tell us, I guess, why this person was tested, this possible community case. Was it somebody who was in a hospital? Was it through a family doctor, through calling 811? How did this person end up getting tested? How was this caught, I guess?
So I can't speak to individual cases, but I can speak in generalities with regard to sentinel testing and physicians' and clinicians' ability to use their clinical judgment. So throughout the entire time that we've had this pandemic occurring globally, and we're aware that cases were being imported to Canada, we have started testing people as far back as February. And so as the case definition changed in terms of the risk areas that people could have been exposed to COVID-19, and our testing revolved around those risk areas, as things evolved even throughout the entire time, if a clinician had a suspicion, they would speak to public health and they would get a person tested. And throughout this time, in the most recent past, if a hospitalized patient had symptoms, they were tested. So I can't speak specifically about this particular case, but I can just tell you that in situations where clinicians have used their judgment, then some people who did not have a history of travel could be tested, and so that has happened throughout the entire time of this pandemic.
I'm sorry, but I fail to see how telling us how this person got tested would violate any sort of privacy, even just by telling us generally if it was through contacting a clinician or if it was through calling 811 or through if they were in the hospital already.
I hear what you're saying, Silas. I really do understand, and again, I'm erring on the side of caution because, again, I do have to protect confidentiality of patients. So I hear exactly what you're saying. What I'm saying is in a general sense that most of the cases that have been tested have come through 811, but there are cases where a physician can refer for testing as well, and that has been the case throughout this entire pandemic as far back as the middle of February.
Thank you. Vicki Hogarth, Charlotte County TV.
Thanks, Dave. My question is for the Premier. The demand of food banks is going up, and at the same time, donations to many, such as in St. Stephen and St. George, are going down. Are you in correspondence with local food banks across the province, and is there additional support for them right now?
Yes, we are, and it's through our social development office, and our minister is very actively engaged in communicating with different support groups within communities. Thank you. Elizabeth Fraser, CBC.
Hi, my question is for the Premier. Journalists have been told that you and Dr. Russell are the only people allowed to speak on behalf of government. And this is at a time when people are looking for more information than ever. Other provinces also tell the public more about COVID-19 cases, and I'm thinking of places like Prince Edward Island and British Columbia. Can you explain why we aren't allowed to ask questions to other cabinet ministers, such as the Minister of Education, and why the public isn't allowed to know more about cases of COVID-19 in their communities?
Well, certainly in relation to our public health officer, Dr. Russell, she's explained very thoroughly about the concerns about confidentiality, and it's certainly within her purview to decide what is appropriate to share for details and what's not. In relation to the two of us being the spokespersons for this, it was to provide continuity. I think through all of this, we certainly need to hear from the public health officer, daily or routinely. Whether it's daily or not, I guess, is to be determined as we go forward. But in terms of my role, speaking as on behalf of the government, is the reason that I'm here. But I would say that there will become, I would say, going forward, times when we will want to have other health or other ministers involved. I think particularly of the our Minister of Social Development and the questions related to issues within communities and food banks and other charitable organizations and support that I was just asked. I think in terms of our education system as we're going forward and defining what e-learning looks like and what that means in this time and to get started back up, I think we'll see, reviews that'll come forward for technical reviews from our departments. The Minister of Health, obviously, going forward with as we ramp up in our capabilities with our health authorities in actually responding to what's been determined going forward. I think you will see individual departments play and individual ministers play more of a role in specific areas. We're doing this together to provide continuity, to provide a process that people can get used to, but I can see it evolving as time goes on.
Okay.
Charles Camillon, TVA.
Just from CBC has been receiving question after question from our audience about why we're being blocked to speak to people like the Education Minister, Dominic Carty. I don't understand why we can't speak to ministers like Dominic Carty or Ted Fleming. I still don't understand that when there is a pandemic going on.
Well, I think I've just adequately explained that, and that opportunity will come forward, so I don't think there's anything more I can add to that. Charles Camillon, TVA.
Oui, ma question s'adresse à Dr. Mme Russell en français. Vous l'avez mentionné un peu tantôt en anglais, et j'aimerais que vous répétiez un peu plus en français. Vous disiez, exemple, lors du premier cas annoncé cette semaine du côté du Nord-Ouest, vous disiez que ce premier cas-là avait voyagé. Finalement, vous êtes ravisé et vous avez constaté que c'était des personnes qui étaient en contact avec ceux qui auraient possiblement voyagé. Ma question est la suivante. Est-ce que, exemple, dans le Nord-Ouest ou à Edmundston, vous continuez à faire une espèce d'enquête épidémiologique pour savoir qui aurait peut-être voyagé dans la région du Nord-Ouest et qui aurait peut-être le cas de la COVID-19? Est-ce que vous retracez ces cas-là, exemple? Je ne sais pas si vous comprenez ma question. Voilà.
Oui, je comprends la question et aussi pour protéger la confidentialité des gens en question. Quand on fait les investigations, quand on demande les questions pour savoir qui les gens étaient en contact avec, c'est pas que la personne comme telle, la personne qui a le COVID-19 comme tel a voyagé eux-mêmes, mais c'est si on peut identifier des cas, des contacts qui ont un lien à quelqu'un qui a voyagé. Alors, comme par exemple, un des cas ici au Nouveau-Brunswick qu'on avait annoncé déjà, j'avais annoncé après des cas qui ont voyagé, les cas qui étaient en contact avec cette personne qui a voyagé. Et aussi, après ça, si le COVID-19 a été transmis à d'autres personnes après ça, c'est encore considéré comme un cas lié au voyage. Alors, quand même que la personne comme telle n'a pas voyagé, si c'est lié à quelqu'un dans la chaîne de transmission qui a voyagé, c'est dans cet instant-là qu'on peut dire, oui, c'est lié au voyage. Alors, c'est pas que la personne comme telle avait voyagé, mais si on était en contact avec quelqu'un dans la chaîne de transmission de quelqu'un qui a voyagé. Quand on ne trouve pas qu'il y a un lien avec quelqu'un dans la chaîne de transmission de quelqu'un qui a voyagé, c'est dans cet instant-là que je peux dire que c'est la transmission dans la communauté. Et les gens qui sont sous l'investigation maintenant, je veux protéger leur confidentialité, mais on n'est pas complètement fini de faire notre investigation. Des fois, ça prend du temps pour trouver cette information. Alors, avant que je peux vraiment donner la conclusion exacte, c'est pour ça que je dis que c'est possible.
Alex Ewert, Media Q. Alex, are you there? Mathieu Roy-Como, la Petite Nouvelle.
Bonjour, je ne suis pas certain que ma question est pour Mme Russell ou M. le Premier ministre, mais si je suis censure, j'entendais peut-être les deux. Le gouvernement des communications nous ont dit tout à l'heure, m'a dit tout à l'heure qu'il ne partagerait pas le nombre de tests qui a été effectué par région. Je me demandais comment le public est censé pouvoir évaluer l'effort qui se fait un peu partout, y compris en région, si on ne peut pas savoir le nombre de tests qui se fait en région.
Alors, je comprends la question, c'est que vous voulez savoir pourquoi qu'on ne peut pas donner le nombre de tests par région?
Pourquoi vous ne pouvez pas donner le test et comment les gens sont censés évaluer la qualité de l'effort qui se fait en région si on ne peut pas avoir le nombre de tests par région?
Oui, je comprends la question, puis je crois que quand que j'avais eu cette question avant, je crois que j'avais dit que j'allais m'informer si c'est possible d'avoir les tests, les résultats de nombre de tests par régie. Alors, je vais parler à mon équipe sur ce sujet. Mais si on voulait comparer les nombres, si vous avez tous les endroits du province, puis vous dites, OK, ben si on fait moins de tests dans un tel endroit ou un autre, ça veut dire que nos efforts sont pas à capacité ou au maximum, ou nos efforts sont pas jugés à être ceux qui sont justes ou la bonne balance. Je dirais, je vais répéter ce que j'avais dit en anglais, c'est vraiment important de tester les bonnes personnes pour les bonnes raisons à le bon temps. Alors, ça veut dire qu'on ne peut pas tester les gens qui sont pas dans avant qu'ils ont développé des symptômes. Après environ 10 jours, ils ne vont pas avoir le virus ne va pas être dans leur test. Alors, ça veut dire que ça se peut qu'on va avoir des tests négatifs aussi. Alors, il y a beaucoup de raisons qu'on teste et jusqu'à maintenant, c'était les gens qui ont voyagé. Alors, vous pouvez voir qu'on fait plus de dépistage, plus de tests, plus d'échantillons dans des endroits où les gens ont voyagé plus. Même au fur et à mesure que ça change à la transmission communauté, la priorité va être pour les travailleurs dans les endroits d'institutions pour la santé, comme les hôpitaux et les autres endroits comme ça.
Ben Burnett, CHSJ.
Hi there. A question for Dr. Russell. We're seeing reports online of symptoms related to loss of taste and smell. I'm wondering if that's something that residents should be self-monitoring for at this point, or is it too early to be sure that that's a symptom of COVID-19?
Yeah, I read that myself. I think, again, when I was talking about testing people, if you test at the wrong time, you're going to get a false negative, so we don't want that to happen. But the other thing is, I'll repeat the same messages around staying at home and self-isolating as much as possible, is that if everybody's following the advice, and if you're not an essential worker or healthcare worker or critical infrastructure worker, everybody should be staying home with the exception of running errands and going for a walk and staying 2 meters away from people. So I think, again, you can talk about these types of symptoms. I haven't read anything evidence-based around that, but I did read the articles around those early symptoms. But my advice will still be the same, is everybody in the province really needs to be staying home as much as possible right now, and it's really the best chance we have to slow down the transmission of this virus. There's really no way around it.
Laura Brown, CTV.
Hi, Dr. Russell. I'm wondering if you can tell me at this point, now that we've been, I guess, doing this for a couple weeks now, if you could foresee a time where you will start to ask people to quarantine for longer than 14 days, so instead of 2 weeks, 3 weeks, if you think that would be, I guess, more prudent when it comes to symptoms and avoiding a false negative.
I just missed the very, very end of your question. You're asking if I would be asking people to stay at home for longer than 14 days. And I actually spoke to my team yesterday about specific situations right now that could happen, and that would be in a household where there were multiple people living in that household, and they would have to self-isolate perhaps longer than that, but it would be based on the last person who developed symptoms and was diagnosed everybody in that household will have to self-isolate until that person no longer had symptoms or they were home for about 14 days. So that could add up to longer than 14 days, but that's a very specific situation that I can speak to. In broader sense, I can't think of another situation where people would have to self-isolate for longer than that.
Okay.
Kevin Bissett, Canadian Press. Isabelle Larose, Radio-Canada.
Oui, alors ma question s'adresse au Premier ministre. Il y a des informations recueillies directement sur le terrain au point de contrôle de Campbellton qui laissent entendre que les directives données par vos agents aux Québécois qui veulent entrer au Nouveau-Brunswick varient selon la personne, si elle est autochtone ou non autochtone. Donc, que les gens de la communauté Mi'kmaq gaspésienne de Listigouche ont un accès plus facile. Par exemple, qu'ils peuvent continuer à aller faire leur épicerie au Nouveau-Brunswick alors que l'accès est refusé aux non-autochtones. Pouvez-vous me confirmer que cette directive est bel et bien en place et expliquer pourquoi?
Of course, it's not a directive. Everyone will be treated the same based on where their destination is, what the purpose of the trip is, and the idea is it essential service or is it not. There will be no application or directive based on any sort of background or ethnicity.
C'est pas ce qu'on voit actuellement sur le terrain.
Pardon, répétez s'il vous plaît.
Ce n'est pas ce qu'on voit sur le terrain. Là, les gens qui sont sur place confirment ces informations-là.
Well, I assure you that's not any directive, nor is it acceptable, and it will not be happening.
Merci. Danielle McCready, CBC.
Hi. So my question is for the Premier. Do you know if the province is collecting the same information for people landing at airports that it's collecting for people driving across the borders? And how is that information being collected? How is the information collected being protected for privacy that you guys are saying is important during all of this?
Well, certainly the information that we're collecting from our officials is information that we're using for our sole purpose of tracking and seeing that people are going to their homes if it's a self-isolating case. If they're working, as I said, the coming and going from border will get easier as time goes on because there will be a lot of people that will be routinely going for maybe employment or one reason or another. It could be commercial traffic. But our information is exclusively used for our officers and their ability to track individuals, to ensure they're self-isolating as we go forward, to just ascertain the reason for the trip, and if the trip is a pleasure trip, then it's they're to return back home. Our goal is to avoid unnecessary travel throughout our province, as we must.
Héloïse Rodriguez, Radio-Canada.
Oui, bonjour. La question est pour le Premier ministre. Je voulais savoir, la semaine dernière, vous avez dit que les écoles allaient rester fermées indéfiniment. L'île Saint-Édouard vient de dire qu'elles vont être fermées, les écoles vont être fermées jusqu'à la mi-mai, jusqu'au 11 mai. Je voulais savoir si vous avez un échantillon similaire. Est-ce que vous avez une meilleure idée de quand les écoles vont réouvrir et est-ce que ça s'applique aux garderies aussi? Merci.
Héloïse, on n'entend rien dans nos... je ne sais pas si c'est quelque chose avec votre téléphone. Est-ce que vous...
Salut, j'avais essayé. Vous m'entendez?
C'est bien? Oui. Juste parlez un peu plus, on veut voir si on entend le volume.
Que les écoles du Nouveau-Brunswick allaient rester fermées pour une période indéterminée. Je voulais savoir si vous avez une meilleure idée de l'échéancier maintenant, quand elles vont réouvrir, et est-ce que ça s'applique aux garderies aussi?
No, I do not have a timeline when they could be reopened. I think that'll depend precisely on what we see for expansion of our confirmed cases here in the province, and that timeline is variable at this point.
Merci.